Hello everyone, my name is Ahmed Mattar, one of the orthopedic junior doctors from Prince Australia University Hospital, King's College Trust. Today I'll go through an audit of resuscitation status decision for the orthopedic patients under orthopedic team in Prince Australia Hospital. Quickly, we are doing this audit to check and monitor for every patient under orthopedic team, how many patients have the record of resuscitation status, and what is the difficulties we have in the orthopedic team for the junior doctors that they face any difficulties in decision of the resuscitation status for each patient. Let's start with the background that some or most of the SHOs or junior doctors are not confident enough to go for the decision of the resuscitation status, either if the patient for CPR or not. We found some difficulties, and we will go quickly through this audit. The aim of this project is just to make sure that each patient has the record of resuscitation status, and each SHO know when should we go for CPR and when should we go for don't resuscitate form, and when we go for DNAR, which level should we go and which level should we choose. In the methodology of this audit, we checked for 100 patients that have been admitted in May and June 2021 on the system APR. And the patient inclusion criteria showing that the patient should be admitted under orthopedic team and the resuscitation status done by the orthopedic junior doctors, not by any other medical team. Exclusion criteria, we excluded any patient, any child under 18 years old, and any other patient admitted under any other teams. The results, we found that from the 100 patients, we found 78 patients had the record of the resuscitation status, and 22 from the 100, they didn't have any record at all. From the 78 patients who had the resuscitation status record, only 67 were done by the orthopedic team, and 11 from this 78 were done by the orthogeriatric teams. From the 67 patients who have been done by the orthopedic team, 45 done on the day of admission, according to the guidelines, local guidelines, and 13 patients done lately, which means more than 2 days from admission. Is discussion as per trust policy that every patient should have resuscitation status record on the day of admission, and if the patient have any don't resuscitate form or decision, so it should be discussed with a higher level, either registrar or above. The recommendation from the audit that we found, we need to have a teaching session, which has been done by orthopedic and medical registrar as well, and to go for re-audit and check the results after the teaching session. Here some of the results. Resuscitation status showing from the 100 patient, we have 78 patients who had the record. From the 78, 67 done by orthopedic team and 11 done by orthogeriatrics. And from the 67 done by orthopedic team, only 54 on the day of admissions as per trust guidelines. Here we can check the same percent, 78% from 100 patients and 54 done on the day of admission. Here showing 74 patients were for CPR and 26 for don't resuscitate. And thank you so much.